Alright, hello everybody, and I hope everybody's doing well. I just recorded this entire thing, and it didn't pick up my audio, so I'm doing this again, so we'll see how that works. I'm going to be talking about the right to die, or die with dignity, or assisted suicide, and all of these names are what it's called, and so basically what the idea is a terminally ill patient who is in a lot of pain and who only has a certain amount of time to live. Maybe they have 6 months, maybe they have a year, and they're going to die anyway. This is a certainty. They have late stage cancer or lupus or something, some kind of medical condition that the medical doctors have told them you're going to die. It's sadly, and they're in pain all day long, and maybe they can't take care of themselves. They have nurses cleaning up their bodily functions and stuff like this, and maybe it's very shameful. And they feel that it would be better if they just had a soft, easy, carefree way to die, and they could have that last day, and their whole family can be there, and they can talk to them and they can have a proper send off without having to just die in excruciating pain and dwindle over the next six months or however long it is, and slowly just living every day in pain. So I want to talk about who I'm not talking about, and that is just depressed people. So people who are my age, or who aren't elderly, aren't suffering from uh, terminal illnesses, people who are just depressed, and they too wake up every day thinking, I hate this day, I hate living, I hate life, I don't want to go on. So please, may that there's an argument here to be made, but I'm not making it. That perhaps they should be allowed the services of assisted suicide as well. But I think in the vast majority of these cases, proper mental health, medication, and stuff like that can actually help these people have an enjoyable and fulfilling life, and not one that is full of misery, which some people with depression do seem to describe. So, as my visual aid here, let's see if we're going to see if this works. There was a man back in the day that I want to briefly go over called Dr. Kevorkian, and he's here with this machine called the Thanatron, which is like from the Greek god Thanatos, death, the god of death, and Tron, so basically a death machine. So basically, he would go to people's homes. He was kind of a mercenary. He would just go to people's homes, and they would pay him money, and he would hook them up to this machine. And it was very similar to the death penalty, um, how they kill people. And so he would hook them up to this machine, and he would kill them. He got his medical license revoked, and then he moved on to this very roughshod ramshackle machine, which is just like carbon monoxide. So it's kind of like when you see in movies or something, like when someone hooks up a tube to their car exhaust and then puts like or just is in their garage, or people die of this accidentally, which is why we have monitors, carbon monoxide monitors. So basically, he would just hook this up to them, and then they would slowly fall asleep and then die. So he did this after they revoked his medical license to some like 100 people. I think over 100 people, and then he eventually got arrested. He went to jail for like 7 years, and then he was released on the promise that he wouldn't talk about it or do it or advocate it or anything like that. And I believe he kept that promise. So Dr. Kevorkian is important just because he was like a big figure of this and a big like pusher of this idea, but he did it outside the bounds of the law, and I think that the way he did it wasn't really ideal. I think that the ideal way would be legally and within the bounds of a medical setting, and with the obviously the consent of the person. I mean, he always did it with the consent of the person. He was very important, and he did make sure that they had psychiatric evaluation, which we should do. So let me just like recap everything. So like the real reasons for accepting right to die and dying with dignity is the dignity part. That's the main reason. So some people are in complete pain at the end of their life, and they have nurses coming in cleaning their bodily functions. They can't take care of themselves. They're being a big burden on everybody, and they know that they're going to die anyway, and they just think that they would rather go out on their own terms, and it's really their own choice. And this has to do with my next point, which is, so the American Constitution says we have a right to life, liberty, life, liberty, and happiness. So the life there, I think, the right to life also, if you have a right to your life, you have a right to control your life, and therefore when to end it. So I think that the Constitution sort of guarantees this right. At least again with terminally ill and elderly patients. So Also, the concept of bodily autonomy, which people often use for the abortion debate. So the woman has a right to her bodily autonomy. She can do whatever she wants to her body that she wants. I think this argument also holds water for the die with dignity argument. I think you can make the same argument. So an elderly, terminally ill patient has bodily autonomy. They have a right to do with their body what they want, and what they want is somebody to help them die. So the very last point I want to make is just that is sort of a throwaway point, which is just that end of life care costs like just a crazy disproportionate amount of our money. So the last few years of a person's life costs way more than like the previous 20 or 30 years, just because of the amount of medical care and treatment they need for all these just cases, these conditions that come up over and over and over again, and they have to be treated until they finally do die. So some money could be saved, and I don't want to really like use money as an argument for why we should do assisted suicide. That seems a little heartless to me. But I just thought I'd throw it out there that it also makes economic sense. But mainly it's to preserve someone's dignity and to just end the pain and be a mercy to people, to those who are mentally sound and to those who just beg for it. Thank you very much for listening.